those of you who are posting. Okay, so we'll get started. So I'm going to start my video and then turn it off so you can just see who I am in my messy room here. Okay, hello. I'm Tracy Frisch. I'm the chair of the Clean Air Action Network of Glens Falls, and I do not have a good Wi-Fi connection, so I keep my video off. So our group was formed in March 2019, and we're building more and more every month, and we really appreciate those of you who have gotten involved. So we're an almost all volunteer organization, with the exception of Abby Peckman, who does our website and our graphic design and a lot of our technical. She's our technical assistant. So we in November 2019, the State Department of Health did a presentation in Glens Falls. They presented their study in which they attributed the high rates of cancer in Warren County, the highest in the state according to that agency, to lifestyle. And at that meeting, I met Paul Hancock, who will be speaking momentarily, and he will tell the story from there. Paul, Dr. Hancock, is professor of economics, professor emeritus of economics at Green Mountain College. He's a resident of Glens Falls, and he will be sharing his findings right now. Take it away, Paul.
Okay, thank you. So I'm going to use PowerPoint, even though I think it's evil, but I still use it. So I'll share my screen with you, and we'll start right off. Maybe I won't share my screen with you. Let me find out.
Why not?
There we go.
Yeah.
Oh, going backwards. So, and maybe I should.
It's working.
Let's see.
I can.
Yeah, and is it being blocked by the views of the of individuals?
It's working
or not?
It's fine.
This works perfectly well.
Everyone, please mute if you're not Paul. Thank you.
Okay, I will start off as Tracy said, in November, the Department of Health concluded their study of Warren County's high cancer rates, and it was a direct charge from the governor to find out why Warren County had the highest cancer rate in the state of all counties outside New York City for 9 separate cancer types. I'm going to show 3 cancer types, and we are going to look at the lifestyle factors that the study claimed were responsible for the high cancer rates in Warren County, as well as the rest of the 56 counties under the study. So their claim was that Warren County was ranked relatively low with respect to a multi-element composite measure of health behaviors indicating less healthy lifestyles. We found instead that the evidence that each of these is elevated among residents of Warren County to a degree sufficient to explain the higher rates of cancer is lacking. So I'm going to show you graphs. Now, I know graphs sometimes are intimidating, but these are simply histograms or Pareto distributions. Each column is a county. And so we'll see right away, we'll do the cancer types first: lung cancer, laryngeal cancer, and colorectal cancer, and show that in fact the study was correct, that Warren County has high cancer rates. So 3 cancers, 3 lifestyle causes: lung, laryngeal, and colorectal cancer, smoking, obesity, and excessive drinking. All three of these cancer types are elevated in Warren County relative to all New York State counties, exclusive of New York City. The reason you leave out New York City is that it's an outlier for all sorts of reasons. And so it's a better comparison to compare us to other counties outside the city. And smoking, obesity, and excessive drinking are closely related with lung, laryngeal, and colorectal cancer as causal factors. All three of these factors we found in Warren County are at or below the median of all New York state counties, exclusive of New York City. The median is right down the middle. So we're at the middle of most counties when it comes to smoking, obesity, and excessive drinking, or below the median, and yet we have elevated cancer rates. So here's lung cancer. The red column is Warren County, and 12 of 56 counties exceeded Warren County's lung cancer incidence per 100,000 population. And it was some 81, I think, 80.7 was the rate for Warren County. In fact, we can find out what it is if we click on it, I believe. No, I can't find it. And I think it's about 81.7 out of 100,000. So lung cancer is definitely elevated relative to other counties in Warren County. Cancer of the larynx, only 3 counties exceed Warren County in the incidence of cancer of the larynx. And so again, we accept the DOH's conclusion that Warren County has a high cancer rate of the larynx. And colorectal cancer, only 9 counties of 56 exceeded Warren County's incidence of colorectal cancer. So there's no question any the other 6 types of cancer that were studied also were elevated in Warren County relative to the rest of the counties in the state outside New York City. Now, here are the causal factors that this study argues explain why Warren County has a high cancer rate and all other counties' cancer rates as well. And it's obviously well established that smoking is a cause of cancer. We have no problem with that. It would be one thing if Warren County had a high smoking rate, but it does not. It's right down the middle relative to all other counties outside of New York City. 25 counties have higher smoking rates than Warren County's rate. Obesity, 35 of 56 counties have a higher obesity rate than Warren County's. So it doesn't appear that could necessarily explain why Warren County has high cancer rates in laryngeal, colorectal, and lung. And excessive drinking. Binge drinking is defined, I should tell you what the other ones are defined as too. Binge drinking is defined as drinking more than 5 drinks in one setting in the last 30 days. So they telephone people and ask them that question. Smoking is, current smoking is defined as someone who smokes now and has smoked more than 100 cigarettes in their lifetime. So, you know, they didn't just pick up smoking yesterday. So that's excessive drinking. So the question is, why did the New York State Department of Health have different results? Well, they didn't compare Warren County to each individual county outside of New York City. Instead, they had a new data set created, a composite of all 57 counties exclusive of New York City. What that did was, it didn't answer Cuomo's question, why does Warren County have the highest cancer rate of all counties outside of New York City? Instead, it compared it to a multi-element composite of all 57 counties, created, by the way, by the University of Wisconsin, And we haven't. I tried to reproduce it, and I couldn't. So, but at any rate, it was a binary comparison. Warren County's rates of cancer and their health factors with this set of data from the University of Wisconsin that supposedly represented the other 56 counties using weights that I've not yet discovered. But as a consequence, they erased all the differences between the counties and Warren County with respect to those factors, cancer rates and causal factors. And as a consequence, the DOH didn't answer Cuomo's question, why Warren County had the highest rates of cancer in New York State from 2011 to 2016. Now, I'm going to take a leap because I've added another slide to this presentation to show you something to me that to me is rather revealing. And I don't expect everyone knows about multiple regression, but I'm going to quickly give you a tutorial. CR stands for cancer rate. And the right side of the equation, lifestyle choices. So you can imagine all the lifestyle choices that we talked about, obesity, drinking, and smoking as being on the right side. They're supposed to be causal factors that determine the dependent variable cancer rates. So in fact, I ran a multiple regression for all of the data for all 57 counties in the state outside of New York City, and I had a multiple regression of 30%. What that means is that all those factors explain 30% of the differences in cancer rates between counties, and it's statistically significant. So 30% is a fairly good regression, but when you use that regression equation that comes out from running that and try to predict the values for each county, if it doesn't predict well, you have something called a residual, or a factor that exceeds the predicted value of the equation for that particular county. Notice Hamilton County and Warren County are very high relative to the other counties. So this means that the equation doesn't predict Warren County and Hamilton County very well at all. But it does predict the other counties fairly well. So in Hamilton County, there's a reason why it doesn't predict it. Hamilton County is the smallest county in population east of the Mississippi, and the average age is 55. So they're bound to have higher cancer rates than the prediction based upon smoking and drinking and obesity. But Warren County doesn't have that excuse. There's no reason why it's an outlier. And so you have to look to other factors as to why Warren County has such high cancer rates. So I'm going to turn it over to David, and he'll explain perhaps where we can find other causal factors. So David, there you go.
I should introduce David because I haven't. Okay, so Dr. David Carpenter is a public health physician whose research focuses on the environmental causes of human disease. He is director of the Institute for Health and the Environment, a collaborating center of the World Health Organization, and professor of environmental health sciences in the School of Public Health at the University at Albany. I will not go further except to say that he has published over 450 publications in peer-reviewed scientific journals. And he is also the former director of the Wadsworth Center for Laboratories and Research for the New York State Department of Health and the dean of the School of Public Health at the University of Albany. So, and I'll just mention, when I sent out a notice about this to some people around the state, I immediately, one of the people from Albany sent it out to her list, and she wrote, "You can never go wrong with a presentation from David Carpenter." So without further ado, let us welcome Dr. Carpenter. Thank you, David.
Well, thank you, Tracy. I'm not sure that that's correct for tonight. I did not prepare a PowerPoint presentation like
Yeah,
like
that's
you've
fine.
just seen. But let me just talk a little bit. So as Tracy said, my research is focused on environmental causes of human disease. Now, I have a lot of experience with the New York State Department of Health. I worked for them for 13 years. I also work closely with the Centers for Disease Control. And one thing I see at both of these organizations, they're important public health organizations, but they consistently minimize the effects of exposure to environmental contaminants in causing human disease. Now, as Paul has just shown you, there is no excess smoking in Warren County relative to other counties in upstate New York. There's no excess obesity. There's no excess drinking. So why is cancer at such high rates in Warren County? Well, in their report, the Department of Health did deal with the few environmental exposures and basically dismissed them. They did talk a little bit about air pollution. They passed off air pollution as being not very important for causing cancer, which is absolutely wrong. The World Health Organization has said that air pollution as a global problem is responsible for not only high rates of cancer, but respiratory disease and asthma and premature death from all sorts of things. So I would really fault the health department for dismissing air pollution. They talked a little bit about disinfection byproducts. So our municipal water supplies are chlorinated. Well, if you add too much chlorine, you can form chemicals, chloroform, bromoform, things like that, that get in our drinking water, and they are carcinogens. So they acknowledge that. The cancers that we saw elevated are not those that are particularly associated with those byproducts, although GI cancer is one. They basically ignored everything else. So I've got a prejudice, I guess, because much of my research over the last 30 years, including starting at the time that I worked for the Department of Health, has been focused on PCBs, polychlorinated biphenyls. Everybody knows that the Hudson River is very contaminated with PCBs coming from the two General Electric capacitor plants at Hudson Falls and Fort Edward. Well, my colleagues, I've been a little bit involved in Hudson River PCB work. Most of my PCB work has been along the St. Lawrence River, where General Motors is the responsible party that use PCBs as hydraulic fluids in their aluminum aluminum recycling plant, or the Housatonic River in Pittsfield, Mass, where again General Electric is the responsible party. But I have studied human diseases that come from exposure to PCBs. Now, I was invited to be an expert for the panel that reviewed for the International Agency for Research on Cancer, part of the World Health Organization, which about, I guess, 7 years ago now, rated PCBs as a known human carcinogen. And they made the specific point that all PCBs, not just those that are like dioxin, cause cancer in people. They found the cancer most strong was malignant melanoma. They found that for breast cancer in women, for non-Hodgkin's lymphoma, there were strong associations. But then they went on to conclude that PCBs basically cause all cancers. They said, well, the evidence for other specific cancers may not be that high, but they all cause cancer. Now, furthermore, in the studies I've done, I found that you can breathe in PCBs and that causes an increase in cancer. And it was interesting because I was involved in a situation where A man and his wife were employed by a company that was responsible for trying to dispose of waste oils coming from capacitors and transformers. And in the old days, those were filled with PCBs. They have been removed from capacitors and transformers more recently. But in these old transformers, capacitors, you didn't know whether they were PCBs or not. So this man and his wife, he was a chemist, she was the cleanup person. They were told to smell the oils to see if they had PCBs. They'd have an odor. It's a odor you have to sort of learn to recognize. Both of them developed several kinds of cancer, clearly from smelling the PCBs. Okay, so let me back up. Let's talk about what's the situation for PCBs in Warren County. Well, my colleagues in the Department of Health have done studies on the PCB contamination of the Hudson River coming from Fort Edward and Hudson Falls. And so they took measurements of the blood levels of PCBs in a number of people in Fort Edward and Hudson Falls. And because Glens Falls was up the river from the site of GE contamination, they made the assumption that people in Glens Falls were not exposed to PCBs. They took measurements of 60 men and 60 women from Glens Falls. And to their surprise, they found that the PCB concentration in the blood of the people in Glens Falls was even higher than it was in the people from Fort Edward and Hudson Falls. And so the real question is, and not only that, let me back up again. Not only was the PCB concentration higher in Glens Falls residents, but it was higher, it was 4 times higher than the average background PCB concentration in the US. So it wasn't background at all. It was a very high concentration. Well, now why would PCB concentrations be so high in Glens Falls? Well, Tom Randall at the Post-Star 20, 30 years ago had all these reports of General Electric dumping contaminated oil, contaminated sediment. They were spraying PCB contaminated oil on the roads for dust control in the summer. They were giving away clean soil for people to fill in their backyard or their front yard. And there's just this whole history, very difficult to rigorously document, of contamination of Warren County with PCBs coming from the General Electric facilities. There was apparently a dredging of the Hudson River back in the 70s. We all know about the dredging that happened 4 or 5 years ago. But back in the 70s, there was dredging of the Hudson River. And nobody quite knows exactly what happened to that dredged material. Some of it was just put on the bank, but a lot of it was distributed around in Warren County. Okay, so I don't mean to say that we have absolute proof that the high rates in cancer in Warren County are due to PCBs. I think they are, but there needs to be more research to determine whether the people that develop cancer are the ones that have high levels of PCBs in their body. There are other environmental contaminants in Warren County that come from various industries. And it's interesting that Tracy and her colleagues with the Clean Air Action Group were concerned about emissions from the Lehigh cement plant, from various plants in Warren County that are putting out air pollutants that contain carcinogens. So they probably contribute. My personal suspicion is the biggest problem are the PCBs. Now, this is a problem because while we may identify the PCBs as a problem and as a potential cause of the elevations in cancer, we don't have any easy suggestion for how you can get rid of them. Are you going to dig up all of the dirt around Warren County and cart it off to a hazardous waste site? That's just not realistic. On the other hand, this is a real threat to the people that live there. Now, much of my recent work has been focused on trying to understand how people get exposed to PCBs. Traditionally, everybody thought that the main route of exposure was you eat contaminated fish from the Hudson River. Well, I don't think there are that many people in Warren County that go fishing in the Hudson River, particularly the part of the Hudson River below Hudson Falls, and then eat those fish, because the health department and DEC have warned forever against consumption of fish out of the Hudson River. A lot of my work, and this is again, mostly around the St. Lawrence River, demonstrates that PCBs are semi-volatile. That is to say, on a warm summer day, they go into the air and you breathe them in. And they evaporate along with water. So if you have contaminated sediments on the shore, as the sediments dry, the PCBs go into the air. We've demonstrated there specific diseases. Now, in the populations we've studied, we've not looked at cancer. We've looked at diabetes. We can demonstrate in the Mohawks that live at Akwesasne along the St. Lawrence River, right next to the General Motors plant, that the PCBs that increase the risk of diabetes are those that are more volatile. We have other research looking at reproductive abnormalities in young women of reproductive age. And we find that those more volatile PCBs alter their menstrual cycles and cause menstrual irregularities, and at high concentrations actually cause women no longer to ovulate, so they cannot become pregnant. So I think these are concerns that that I have that are likely mechanisms that explain the elevations in cancer and probably a whole variety of other diseases. Again, the problem is, what do we do about it? Well, I don't have a good answer to what we do about it, but I will say this. I think that it's just wrong for the Department of Health to try to blame the people in Warren County for their elevations in cancer. They do not smoke more than other people in other upstate counties. They are no more obese than the average person in upstate counties. There's no evidence that they are excessive alcoholics. And there needs to be further study to document whether or not environmental exposures in general, exposure to PCBs specifically, are responsible for the diseases we see. There is little question. We have 120 residents of Glens Falls where we know their serum PCB levels are higher than the top 95% of an average US population. That is a serious exposure. And we know where it came from. Unfortunately, we just don't know what to do about it. So let me leave it there and see if there are questions that Paul and I can answer. Thank you.
Okay, so I just want to encourage everyone. I know several people told me your questions. Please post them in the chat and they will be read. And I also want, let's see, I'm losing my train of thought. Oh, yes, someone who showed up just before we started was sharing information about the PCBs buried in the backyard or in the yard where her parents built their home, and her parents had cancer. I don't know, Susan, if you want to share any of that with the people here now. Feel free.
Yes. My previous address as a child growing up was Caroline Street in Queensbury, New York, which was previously West Glens Falls in my childhood. That home actually wasn't the home that had the PCPs dug up from it. It was diagonally across the street. After that family had moved away, the barrels or dug up from that property, and then the home was resold or torn down and rebuilt and the property resold. But my mother passed from breast cancer. The direct neighbor to her right passed from breast cancer and lung cancer. The gentleman, the husband, passed from lung cancer. The couple next to them both passed from lung cancer. The person directly across the street from my mother passed from breast cancer. The people behind my parents' home, she passed from breast cancer. Her son had leukemia and survived it. My own brother had colon cancer and survived it. The house across from the neighbor behind her, she died from breast cancer. And the neighbor down the block, probably about 3 houses, died from colon cancer. So everybody in the proximity to that home got cancer and died. There were a few people down the street further from that home on 4th Street Extension, because that home was on the corner of 4th Street Extension in Caroline. My parents' home was on the corner of 5th Street Extension in Caroline. She just died from breast cancer recently, and I'm 55, and she was right around my age, maybe a little bit older. And a neighbor further down 5th Street on a side street just died from lymphoma several years ago, and she was my age as well. So it was very, very, just the proximity of my parents' house to every house next to them having someone die, and almost every woman died from breast cancer.
That's horrifying. David, would you like to comment on that?
Well, as time has gone on, we're reducing the death rate from cardiovascular disease. We do all have to die from something.
Right.
So rates of cancer are increasing, and now almost as many people die of cancer as of heart disease. So, it's very difficult when you talk about any one person's cancer to say that it was caused by this. However, when you see these groups of cancer at specific sites, and I would really say at counties like Warren County,
Yes.
then you really need to look to see what the cause is. So I would compliment the governor and the health department for trying to address the issue of why is cancer so high in Warren County. I just think that they missed the boat and made a real mistake at trying to blame people's behavior. No question but what smoking is very, very dangerous.
None of these women smoked either, by the way.
Yeah, well, a lot of people have lung cancer that don't smoke.
Correct.
And, we know a few other causes. There can be radon. I don't know that radon is particularly common in Warren County. There can be asbestos, but, we don't have elevations of those that we know about. So you need to look for other environmental causes as well as behaviors.
Yes, and these properties were previously owned by Finch Prime. And I have the deed to my parents' home showing the purchase.
Okay. Thank you. Yeah, it's very troubling. So I'm going to read some additional questions. Barbara asks, is there a way to get the population to volunteer to get their blood tested for PCBs?
Well, I think the answer to that question is it's probably not difficult to get people to volunteer. What is difficult is getting to people to pay for it. Unfortunately, it is not inexpensive to get a measurement of PCBs. A good high quality measurement that gets the full range of congeners will be up to $1,000 per sample. They're less expensive tests, but they're still going to run $200 or $300 a sample, and it almost certainly will not be covered by insurance. So this is really why it should be the responsibility of our state government to do this kind of analysis and not force it on the individuals that for which we have every good reason to believe that they're excessively exposed.
Mhm, mhm. How can we find out, Tina asks, how can we find out if there are PCBs in our ground?
Well, unfortunately, the same issue applies there. It's less expensive to take measurements of PCBs in soil or PCBs in air, but it still is expensive, usually $150 a sample. So, most people are not going to be able to afford to have extensive testing of their front yard and backyard.
Is there government capacity to do these tests, or would you suggest not going with the government that doesn't have an interest in spending lots of money for cleanup, actually?
Well, the Department of Health has a PCB laboratory. It's not as, when I worked for the Department of Health, I supervised the PCB laboratory. It's not as active as it used to be, but yes, there is facility at government laboratories.
Mhm.
Again, it's an issue of resources. It takes time.
Yes.
It requires expensive equipment, and it's not an inexpensive assay to do.
Emily Tarana from the Clean Air Coalition of Western New York, which we invited to this event tonight, asks, can you speak to a connection to PCB between PCB exposure and autoimmune diseases?
Well, there is some suggestive evidence that PCB exposure increases autoimmune disease, but I think that evidence is not really that strong. Now, one of the issues with PCBs is we know they act like hormones do. They cause induction of many different genes. And that's one of the problems with PCB exposure. We find that many different diseases are increased. I mentioned diabetes and menstrual irregularity. We've already demonstrated elevated blood pressure, certainly cancer, interference with thyroid hormones. PCBs in general suppress the immune system. And of course, this is a concern in the era of COVID-19, because if you're exposed to PCBs, your immune system is not very active. In addition to not being as effective against preventing disease, PCB exposure in children has been demonstrated to reduce their immune response to immunizations. So, I'm giving you all kinds of bad news without giving you very much hope of what we can do about it. Let me just say one other thing. There were 3 other places in New York that the health department demonstrated having high rates of cancer. One was in Western New York, the Chicawanda Creek area. There was a place in Staten Island, and
Long
the other
Island,
place was
Suffolk County.
Suffolk County, yes. And in every one of those places, the health department blames smoking, obesity, drinking.
They're on a roll.
They're on a roll.
Yes.
It's one message, you just throw it out to everybody.
Yes. Maureen asks, can soil be tested for historic presence of PCBs? I'm not clear if that's different than if PCBs are present. I mean, they don't go away if they're in the ground unless they're dug up and removed. They don't break down, which is one of the many issues with PCBs.
Well, PCBs are called persistent organic chemicals because of the fact they don't break down rapidly. GE stopped dumping PCBs in the Hudson River a long time ago. It's still highly contaminated. When people get exposed to PCBs, especially from food sources like fish, I usually say the time it takes to have your body get rid of half of what you had for dinner last night in that contaminated fish is 10 years. The body can't destroy these molecules efficiently. It does slowly, but the problem is for most of us, since PCBs are now distributed in the food supply, so they're in all animal fats, they're in butter, they're in eggs, they're in beef, they're in poultry. And there's another story about why they're so widely distributed. But for most of us, we take them in more rapidly than we can degrade them. and therefore the levels in our body do increase as we get older. So the good thing in terms of study is that we can take a blood sample and get a pretty good suggestion of what your exposure was over many years. But the problem is we don't know how to efficiently get rid of those from your body.
Yeah.
The only mechanisms that have been demonstrated are if you eat a lot of olestra, which is a fat that the body can't absorb. This was what was used to treat the president of the Ukraine that was poisoned with dioxin. Now, the problem is that if you take a lot of this olestra, it does pull the PCBs or the dioxins out of your body into the gut and it's excreted, but it also causes violent diarrhea and you lose all your fat soluble vitamins. So it's not really a very realistic way to get rid of PCBs in your body.
Wow.
Has to be done under very careful medical supervision.
That sounds horrible. Is there a way to get records of where the soil was distributed by GE, I would imagine? Or is this a matter of testing of all soil? And this question comes from Jacqueline.
Well, I don't really know the answer to that. I think a lot of the places where this was given out had probably no records at all. But there were some records, and I've gone back and tried to find links to those that other people have reported, people in the news media and that sort of thing. I don't have access to that kind of data. I suspect much of it is totally lost, but I'll bet you there are individuals that date from those times in the 70s and 80s that would have some specific information about where the contaminated soil was deposited and where the oil was sprayed on the walls on the roads for dust control.
Yes, and we're actually, several people in our group in the Clean Air Action Network are going through the archives of the Post-Star to look for those stories. But if anyone wants to volunteer to help with this new and unplanned project, you can post in the chat and we'll get back to you. So the next question is from Barbara. Should data be collected like that in the documentary we saw on Pittsfield, Massachusetts? I'll be sending the link out to later this week to everyone so you can see this excellent 90-minute documentary on PCBs in the Pittsfield, Massachusetts area from the GE plant. Dr. Carpenter is in that movie. Has a small role, but he is in it. So let me finish this question. What would the impact be here locally other than to have people move from their homes if they are contaminated?
Well, that's really the problem, that there isn't an obvious, easy, cost-effective solution. And in some ways, it's the problem with PCB exposure around the world, that once they're in the environment, they stay there, but they also move into people. Once they're in your body, it's hard to get rid of them. So I don't have an easy answer to that question.
Yeah. Christine asked, how can we obtain the actual DOH study? And I will send a link to everyone of that study. It's readily available on their website. A comment from Linda, Haviland's Cove area is right next to the Hudson River. I guess that's in West Glens Falls. Rosemary stated, indoor radon is a known carcinogen, especially lung cancer. After I asked if DOH had looked at radon, DOH added a brief recommendation for people to test for indoor radon. Do you want to comment on whether the radon could explain the excess lung cancer, David?
Well, yes, it's very clear nationally and actually globally that smoking is the #1 cause of lung cancer. Radon is the #2 cause. Radon, if you breathe it in, radon is a ionizing form of radiation. Unfortunately, radon is a gas, and it decays if it decays in your lung, not only does it release radioactivity, but what it decays into is still another radioactive compound, but that's no longer a gas. So it sits there in your lung and goes through several additional decays. So radon's a very dangerous thing. It's relatively easy to test your home, usually your basement, to see whether you have elevated radon there. It's a variable. It depends on how much radium, which is the parent of radon, is in the bedrock below your home. Because then as it decays to radon, it percolates up through the soil and can get into your basement, into your home. But health departments, the county health departments are the ones that can help you get these radon tests for your home.
So is it possible,
Rosemary is shaking her head no.
maybe they're too busy with COVID? So
That's part of it, but in general, between state DOH, which I encountered, and the county, don't expect any help. It's very easy to test on our own. This is the one thing that's good, the one bright shining thing, although it's a stupid thing to be grateful for, is the government can't help us, but we can go out and buy a radon test ourselves and then figure it out.
okay, I'm going to bring back, because we have 15
Yes. That's
comments, and they might be, I can't tell if they're questions or comments until I scroll down. A lot of things. Okay. Stephanie asked, how did they collect the data from the cancer patients? They didn't, but I'll let David answer this question.
Well, I don't
Maybe
think there was any
data collection.
data collection of cancer patients. It was using cancer registry, which is if you develop cancer and you're a New York State resident, the doctor that diagnoses it has to tell the cancer registry who you are, where you live, what kind of cancer you have, and that's where this data came from. But they don't have information on the specific patient is whether they smoked or whether they were obese or whether they drank a lot.
Or whether they lived in whether they ever lived on a PCB contaminated site, or whether they had occupational exposures to any carcinogens at work, or a whole list of other things they didn't know, right?
That is correct.
Okay, Christine asks, where were the cancer rates age adjusted? Oh, and Paul answered by county, yes. Okay. Barbara asks, are PCBs still entering the environment now?
The answer to that is much less than they used to be, but they are still entering the environment. There still is a leak of oil from the bedrock around the GE plants. The problem with PCBs is that they are so distributed everywhere. I mentioned they're in all animal fats, and you know, the reason for that is interesting. If you raise beef cattle or any kind of cattle, you send them to market, there's a lot of fat that's waste. Well, you know what what our industries do is take that waste animal fat and put it into animal food, because if the food your cows eat has got fat in it, they grow more rapidly. Well, what that does is to recycle these PCBs that maybe got into the food supply 30, 40 years ago back into the animal fats. So that means that we're all exposed to some background level every time we eat animal fats. Add on top of that, if your home is on top of a place that has PCB contaminated soil, those PCBs go into the air and you breathe them in, especially in warm weather all the time, that adds. So while everybody is exposed to PCBs, some of us are exposed to excessive amounts, and that's because of elevated levels in our immediate environment.
And I will just mention, if you are a eater, if you eat animal products, if you eat organic, you will not be getting this recycled PCB contaminated animal fat in your food.
Well,
In
that's,
the
you know,
feed.
that's partially true. It's less, but
Well, because you're not allowed to feed that old fat to your animals if you're an organic farmer. You might be getting PCBs from other sources, but that will not be one of them, because all the feed that you feed has to be organically certified. It's, yeah, anyway, we'll move on. I'm gonna, I think, I'll just read this well, I'm gonna go on, Rosemary, beyond what you have, and if we have time, I'll go back to that because we have all kinds of other questions. Nancy asks, who can someone contact to get tested for PCBs in their blood? Nancy is a person who has had 3 types of cancer and has lived along the Hudson River for 50 years and is willing to pay for the test.
well, the thing to do would be to go to your physician, have them draw a blood sample, and then send that to a commercial laboratory to do a PCB measurement. A number of the commercial laboratories will do the relatively inexpensive ones. LabCorp will do that. The problem is that they often don't have good comparison data for other people, but that would be the simplest way to do it. The better labs are going to be much more expensive, and probably you would need to contact me to get contact information for the labs that are not just the general clinical chemistry laboratories.
And so people who would like to contact Dr. Carpenter can contact the Clean Air Action Network, and we'll put you in touch, or contact him on your behalf, depending. Diana asks, if PCBs are airborne, can you filter them out?
There are ways that you can trap PCBs in air, but they're not realistic to do on a major level. So I guess the answer is no.
Mm-hmm, mm-hmm. Yeah, and if you're breathing them outside, how can you filter them, right?
That's right.
So Sean asks or says, sometimes the smell of the exhaust from Finch and Lehigh, from the Finch and Lehigh smokestacks can be nauseated. When was the last time the state measured harmful air pollution coming from those stacks? And I will take a stab at that, Sean. The state does not do any direct testing. The state does not monitor air pollution in the Glens Falls area or anywhere within many miles. So both Finch and Lehigh, and also Wheelabrator Hudson Falls, which is the trash incinerator in the village of Hudson Falls, they all have Title V air permits, which is a federal air permit, but DEC administers that program. These industries, these corporations hire an air testing company which comes at a designated time that they arrange and test the air from in their smokestacks. And that could be once every 3 years, once every 5 years. It could be for a 6-hour period every 3 or 5 years, depending on their air permit. So there's no continuous monitoring for the worst pollutants. There is continuous monitoring for like carbon dioxide and carbon monoxide and things like that, but not for dioxin or some of the other emissions. And then what happens is the industrial polluter extrapolates from that 6-hour air test and comes up with an annual emissions rate. So that's where we get our numbers. They're not very accurate. They're better than nothing. We do know, for example, that Wheelabrator is a very large emitter of lead and mercury, but we do not have an accurate measure. We also know that Finch was one of the biggest air polluters in the state at a certain period. I don't remember how many years ago, by weight of air pollutants. But so I hope that will be an unsatisfying answer, because to me it is very unsatisfying to learn how they get the data from air pollution for air pollution. Christine asked, when was the PCB fish advisory the fish advisory issued? Because of the long half-life and the long latency of many cancers, isn't it plausible that fish consumption in Warren County could play a role?
Well, I think it certainly is possible that fish consumption could play a role. The fish in the Hudson River are highly contaminated. Now, upstream from the GE plants, the fish should not be so contaminated. But, you know, that was the assumption that was made, that Warren County shouldn't be contaminated. But if contaminated sediment was spread along the upper Hudson above Hudson Falls, then maybe those fish are contaminated. I don't know whether there have been measurements of fish above the Hudson Falls part of the Hudson or not. But contaminated fish are certainly a route of exposure.
Okay, I'm going to try to speed up. Rosemary posted another risk not mentioned this evening is too shallow, poorly located municipal wells. For instance, DOH surveyed Johnsburg source water, and for the years 2013 to 2018, every Johnsburg annual report had to say the water source, this is a little anyway, the Johnsburg annual report identified the water source as having elevated susceptibility to microbials, salt, sulfate, nitrate, industrial solvents, and other industrial contaminants, close proximity to permitted discharge facilities, wells draw from an unconfined aquifer. I'm going to move on. There's undoubtedly many sources of exposure, of environmental exposure to carcinogens. And I'm just going to try to, we're at the time when we said we would end, but I'd like to go through the questions. Nancy asked, how do airborne emissions such as particulate matter 2.5, which is the really small stuff, nitrogen oxides, lead, mercury, and sulfur dioxide, I guess, how, are they a problem with cancer?
Well, certainly the particulates are a problem, primarily for lung cancer. Actually, the particulates are a greater risk for cardiovascular disease than they are for lung cancer. But lead and mercury are not carcinogens, but arsenic and cadmium can be come from air pollution, and they are carcinogens.
Okay, great. I'm trying to answer people's questions and read, so this is getting a little tricky. Pema stated the former drive-in theater in Hudson Falls, that is the area around Ginny Ray's restaurant, has had PCBs spread for years for dust control. It had been a flagged brownfield. When Hudson Falls wanted to purchase the land to build, on, they had the PCBs dug up, and now it has been approved, and Schimmerhorn wants to build apartments there. How do we know it was all cleared? Who determined that? Excellent question.
And I certainly don't know the answer to that.
Yeah,
Paul?
there's gonna be a lot of research to do. Tina, oh, I'm sorry, I just skipped some questions. Let me go back. I may skip some questions because it's the best I can do. Tina asked regarding smoking, alcohol, and obesity. Hudson Headwaters Network is asking about that all the time. Oops. So I'm sorry, something just happened. Let me go back and try and find, oh boy. Hudson Headwaters Network, Health Network is asking about that time at appointments, almost to the exclusion of asking about what health problem is bringing you in. My impression is that there is an agenda going on broadly to essentially blame people for their health problems.
I would agree with that. If agencies blame people, then they don't have to take any action on their own part. Now, no question but what our personal behavior does increase our risk of disease. But should be the responsibility of government agencies to not just blame people, but to find factors in our society that can be dealt with.
So I'm sorry, I'm having trouble scrolling with this for some reason, but let me see. So Stephanie says, okay, that was what I was wondering. I knew that the doctor reports to the state, but I was curious, how do they get the smoker, alcohol, and obesity data? Paul, do you want to comment on that?
Yeah, all I know is that they do surveys, and there is a great deal of doubt about how some of this data is collected. For example, the smoking rates are collected by telephone. They phone a certain percentage of the people in a county, and they are only people who have landlines. And only 40% of Americans have landlines. So it's questionable how accurate the current smoking rate is.
Yes.
And I think it's a similar process by which they collect, data on obesity. It's probably not as precise as we would like, but it's the best data we have. The other thing about tobacco is that tobacco sales have been declining at 4 or 5% every year. And they've been declining at such a rate that the tobacco industry has found a unique way of promoting the consumption of cigarettes, and that is to give them away as a way, I would imagine, of getting more people addicted. So the tobacco industry is probably exporting more of its production every year to developing countries.
So Paul stated that just to show that we're not allied with the tobacco industry. Pema stated, a realtor told me that the Haviland area has high levels of radon and suggested to be careful if buying a house there because it's expensive to install a radon filtering system. Maureen asked, how can we change the data collected on cancer patients? Is it a DOH decision or do citizens have some say in it?
Well, that's a good question. I think that the cancer collection, the data collection is mandated across the state for the cancer registry. I don't know that citizens really have any say there, but the cancer registry is a very good registry. There's no question about that. And there is this requirement that any person diagnosed with cancer must be reported to the cancer registry. They don't have the behavioral factors. That's totally independent. And that may be one of the problems here in the health department's report.
Right. So they have no idea if a cancer patient was obese or a smoker or some other things, right?
That is correct.
But they also don't know if that person lived on top of a contaminated site or was exposed at work or what they ate or anything else.
That's correct.
Rosemary asks if anyone has looked at state DOH annual compliance reports by county. These actually are line item reports of water supplies in non-compliance for one or more regulated items, self-reported in general. We might
Paul,
not have
do you
an
have any
answer.
answer to that?
Excuse me? If any,
I'm asking if Paul has an answer.
oh, okay.
Okay, which question was that? I'm sorry.
Has anyone looked at the State Department of Health annual compliance reports by county? And this is about water supplies that are not in compliance for one or more regulated item.
I can't answer that question. I'm not sure.
Yeah, there's obviously a lot of factors and we can't do a ad hoc epidemiological study right here today. But as an all volunteer group with one small exception, we are not up to that task. Diana asked, can an air filter cleanse PCBs from inside air? Um, and I think David kind of took a stab at that before.
Yes, I
Uh,
think the answer is there is not a good air filter that would do that.
And we have a lot of people thanking everyone for coming and for great questions. Linda asked, does the Department of Health have any interest in suppressing environmental causes of disease?
Well,
I can, or David, yeah, go ahead.
I don't think that they would ever acknowledge that they do. But, you know, again, there's a unspoken sense that if you blame the victim instead of identify causes that you might have to take some action about, it makes life easier. So I don't think that they are intentionally underestimating environmental causes of cancer, but they're not very aggressively going after them either.
Okay, I think we're coming to an end, amazingly, although I'm sure we could talk and ask questions for many hours. Tina identified a couple of things that I might not have asked clearly or sufficiently. Nancy asked, how do airborne emissions I didn't see the second part, interact with PCBs in causing cancer?
Well, we're all exposed to mixtures of chemicals. That's from the air, that's from what's in our food, what's in our water, and so forth. And so these mixtures can do things that any one compound by itself cannot. That's a very active area of investigation. And I think the overall answer is that we still don't really know. But we certainly know that when you're exposed to multiple things, the risk is probably greater than just the sum of the individual risks.
So, and the other thing that I missed, I think I read this question, but I don't think we have an answer. And that is PCBs were spread for dust control in around at the former drive-in theater in Hudson Falls, and who determined that it was all cleared up. And we do not have that information, Pema. That is a good question, but it's pretty complicated to find that out. And yeah, so we'll be looking into some of these things further. Once again, if anyone has any interest in helping, we do not yet know what the scope of helping will mean. We can discuss some beginning things, and if you have any ability to help in any way, please post in the chat or contact the Clean Air Action Network tonight or tomorrow or in the next few days. PEMA's bringing up the Environmental Working Group has water quality levels for every zip code. Glens Falls has 10 to 15 toxic chemicals in the water supply, including hexavalent chromium. Tina posted the cleanup of brownfield sites is overseen by DEC, which will have reports detailing the cleanup plan and results from any samples taken prior to, during, and after cleanup. And I just want to point out that I did have some communication with the Clean Air Coalition of Western New York today, and there were 100. I read an article. I'll try and post that on our website. There were tens of thousands of gallons of PCBs that were released and are under a neighborhood, and that is one of the hot spots in the Department of Health study of high cancer rates. So they in the Buffalo area, that was their high cancer rates were also attributed to lifestyle, but the amount of PCBs in this neighborhood was mind-boggling. So just want to mention that. So thank you, everyone. Do you have any final comments, David or Paul?
No, I thank you. You've asked very good questions, and I wish that we had very reassuring answers. Unfortunately, I think we don't.
I would say that most of these issues will likely only be resolved if we organize as a community and pose our concerns to local and state and county government. I don't think, for example, the Department of Health, I think it's sort of like a drunk who looks for their keys under a lamppost. And when asked why, say because that's where the light is. I think that's why they settle for blaming victims, because they don't want to challenge corporations. So we have to force the issue on our public officials. And we can only do that by organizing as a strong community.
And we are organizing, and we welcome your participation. I want to just say one more thing. We are a mostly volunteer organization, and we are powered by memberships and donations. To support this kind of work, please go to our website and make a contribution. And we depend on your generosity to continue our work. Thank you, everyone. And with that, I think we will close the meeting. And so thanks, David and Paul and Abby and everyone for attending. Look
And
forward to
thank you
seeing
for
you
all of your
again
good
soon.
questions.
Yes, many
Yes.
good questions. And I apologize if I didn't get to read everything, but it was a very crowded chat. And so, feel free to write letters to the editor or make statements at your town board meeting. That's the way we start bringing the issues into the foreground. So have a good night.
Thank you, David and Paul.
Thank you.
Yes, absolutely. Thank you.
Thanks for